The stem cell storage process begins with collection from sources like umbilical cord blood, bone marrow, and tissue samples. This crucial step must be timely, especially for cord blood, collected post-birth. Next, collected stem cells are processed in labs, screening for contamination before separation. They undergo cryopreservation using protective agents and are securely stored in monitored facilities, ensuring traceability through unique IDs, ready for future therapeutic needs. ChatGPT. You said, how stem cells are stored. ChatGPT said, stem cells are stored very carefully to keep them alive and functional for future use. The main method is cryopreservation, which means freezing them at extremely low temperatures, usually in liquid nitrogen, at about 196 in degree Larg, 321 Bredig. Here's a simple breakdown of the process. Collection. Stem cells are first collected from sources like bone marrow, umbilical cord blood, or blood. Processing. The cells are separated and treated with special solutions to protect them from damage during freezing. These solutions are called cryoprotectants, like DMSO, dimethyl sulfoxide. Freezing. The stem cells are gradually cooled down to avoid ice crystals forming inside the cells, which could damage them. Storage. Once frozen, the stem cells are kept in liquid nitrogen tanks, where they can be stored for years or even decades without losing their ability to grow or function. There are also newer methods like vitrification, a kind of ultra-rapid freezing, that are being used to improve survival rates after thawing. Would you like me to explain how stem cells are thawed and used after storage too? ChatGPT. You said, list of diseases cured by stem cells. ChatGPT said, stem cells have not yet cured most diseases outright, but they are used successfully in treatments, especially to repair or replace damaged tissues. Some diseases are already treated with approved stem cell therapies, while others are in clinical trials or experimental stages. Here's a breakdown. Diseases currently treated with stem cells, approved and widely used therapies. Blood cancers, leukemia, lymphoma. Multiple myeloma, treated with hematopoietic, blood-forming stem cell transplants. Bone marrow failure syndromes, aplastic anemia, myelodysplastic syndromes, inherited blood disorders, sickle cell anemia, thalassemia, immune system disorders. Severe combined immunodeficiency, SCID. Other rare immune deficiencies, metabolic disorders, some, Hurler syndrome, MPS-I, adrenoleukodystrophy with bone marrow transplant. Diseases where stem cells are experimental or in clinical trials. No guaranteed cures yet, but promising. Type 1 diabetes, beta cell regeneration. Heart disease, repair after heart attacks. Parkinson's disease, dopaminergic neuron replacement. Spinal cord injury, repairing nerve damage. Stroke recovery, macular degeneration, vision loss. Osteoarthritis, cartilage regeneration. Liver diseases, hepatic cell replacement. Chronic obstructive pulmonary disease, COPD. Multiple sclerosis, MS. Lupus, autoimmune reset using stem cells. Crohn's disease, immune modulation. Important notes. Hematopoietic stem cells, from bone marrow, blood, or umbilical cord blood, are the most established and used in clinics. Mesenchymal stem cells, from fat bone marrow or umbilical cords, are being heavily researched for inflammation and repair but are mostly experimental. Embryonic and induced pluripotent stem cells, iPSCs, are promising for the future, but not yet widely used clinically. Would you like a separate list showing which diseases are closest to having an official cure through stem cells, like late-stage clinical trials? I can also break it down by stem cell type if you want. ChatGPT. You said, how we used stem cell for all humans in India. ChatGPT said, you're asking how stem cells can be used for all humans in India. Let's break this down clearly. What are stem cells? Stem cells are special human cells that can develop into many different types of cells, like muscle cells, brain cells, or blood cells. They can also repair damaged tissues. How stem cells can be used for people in India, or anywhere. Medical treatments. Blood disorders like thalassemia, sickle cell anemia, common in India, can be treated using bone marrow, stem cell transplants. Cancer treatment, especially blood cancers like leukemia, uses stem cells after chemotherapy. Organ repair. Scientists are researching using stem cells to repair damaged hearts after heart attacks or liver-kidney damage. Regenerative medicine. Stem cells could help grow new tissues, organs in labs, which could one day solve India's shortage of organ donors. Wound healing and skin repair. Burn patients can use stem cell therapy to regenerate skin. Diabetes treatment. India has a huge diabetic population. Research is ongoing to use stem cells to make insulin-producing cells. Neurological diseases.